has respiratory MRSA, or D, a client who has open wound abscesses? The answer is B, the immobile client with a Foley catheter, because with good hand washing, you'll be able to protect the client who had her fracture reduced. Nurses critically evaluate assessment data and priorities, as well as their own knowledge, experience, and competence when they plan interventions that will successfully meet the desired client outcomes. Nursing research is establishing best practice guidelines to assist nurses in selecting optimal interventions for every common clinical situation. Implementation requires that the nurse work effectively with all levels of care providers to be sure that the most important interventions are carried out. When managing multiple clients, the nurse must apply good time management skills. Throughout the entire care process, keeping the client and family informed and demonstrating a caring and compassionate attitude are paramount. Evaluation is an ongoing process. Nurses must critically review and determine whether or not a client is improving and how the client is responding to therapy. If nursing interventions are not effective, appropriate changes must be made. The nurse is often the person who identifies that a client is not progressing as expected and brings this to the attention of the healthcare team to plan a new course of action. Quite often, a hospitalized client requires the services of various disciplines. The nurse is often the first to recognize the client's many needs. It is important to remember that other healthcare professionals specialize in skills and knowledge that provide good client services. Referrals should be made as soon as possible after a particular need is identified. In some cases, a physician's order is required for a referral. This varies with the agency, and the nurse must know the particular agency's policy. It is ideal to involve the client in the referral process. If the client does not understand the reason for the referral, he might not cooperate with the proposed treatment. When multiple departments are involved in the client's care, the nurse coordinates the referral activities. Often it is necessary to have different therapists collaborate to ensure uninterrupted care. The nurse often suggests times that the client can better tolerate certain therapies. For clients who have multiple problems, the case management model of delivering care might be appropriate. Case management incorporates a multidisciplinary approach to providing and documenting care. A standardized care plan is converted into a critical pathway designed for clients who have a specific disease or condition. The nurse and other team members use these critical pathways to monitor an individual client's progress around the clock. All caregivers use one critical pathway as a monitoring and documenting tool to help them direct the flow of client care. Critical pathways might incorporate documentation to eliminate duplication and reduce the amount of charting. The current trend is for agencies to define expected outcomes and to specify those interventions necessary for each day of care. Because of the nature of human response, there is variance in client outcomes as some clients deviate from the critical pathway plan. These variances refer either to positive or negative changes, depending on the client situation. A positive variance occurs when a client progresses more rapidly than expected, and a negative variance occurs when the activities on the clinical pathway are not completed as predicted or the client does not meet the expected outcomes. An example of a negative variance is the addition of oxygen therapy and pulse oximetry for a postoperative client who develops pulmonary problems. Analysis is necessary to review the data for trends and for developing and implementing an action plan to respond to the identified client problems. In addition, variances can result from one-time causes, from changes in the client's health, or from other health complications unrelated to the primary reason the client needs care. The nurse's responsibility is to correct the variance, or to justify the actions taken to manage the critical pathway deviation. Let's look at this critical pathway example. Critical pathways benefit nurses and clients in many ways. Better communication results in increased continuity of care. Novice healthcare providers have a structure to follow. Clients are involved in the planning process. The entire healthcare team is involved in all phases of client care. Discharge planning and teaching are initiated early in the client's stay, and the creative critical decision-making process promotes better client outcomes. When a client is not part of case management and requires multiple resources, the nurse can initiate a care conference. All disciplines involved in the client's care should be included in the conference. During the case conference, the client's major requirements are outlined. The processes of assessment, diagnosis, planning, implementation, and evaluation are similar to those used in case management. By initiating a care conference, the nurse is acting as a client advocate to ensure that all the client's needs are appropriately and adequately addressed. And that brings us to consultation. Planning care often involves consultation with other members of the healthcare team. Consultation is appropriate at any step in the nursing process, but it is needed most often during the planning and intervention steps, when the nurse is more likely to identify a problem that takes additional knowledge, skills, or resources to solve. Consultation is a process in which the expertise of a specialist is sought to identify the various ways to handle a problem. It is based on a problem-solving approach, and the consultant is the stimulus for change. In clinical nursing, consultation is used to solve problems in delivering nursing care or using resources. Nurse consultants are typically approached for advice about difficult clinical problems. Nursing consultation is sought when nurses have identified problems they cannot solve using their own knowledge, skills, and resources. Consultation increases the individual nurse's knowledge of the problem and helps the nurse acquire skills and obtain resources that help solve the problem. After the consultation, the nurse may be able to resolve similar problems in the future. For example, a nurse caring for a client who has a colostomy may consult an enterostomal therapist to help select the best materials for cleaning and protecting the site and the specific techniques to use during the procedure. For the next client with a colostomy, the nurse will be well prepared. Consultation is also used when the exact problem remains unclear. A consultant can assess and identify the problem objectively and outline a method for resolution. The first step in the consultation process is identification of the general problem area. Second, the consultation should be directed to the appropriate professional. Third, the nurse provides the consultant with pertinent information and resources about the problem area. This includes a brief summary of the problem, methods used to resolve the problem so far, and the outcome of those methods. Other resources include the client's medical record, nurses and other members of the healthcare team, and the client's family. The nurse should be careful not to provide biased information to the consultant. Consultants are in the clinical setting to identify and resolve a nursing problem, and biasing them can hinder problem resolution. Bias can be avoided by not overloading consultants with subjective and emotional conclusions about the client and the problem. Fourth, the nurse requesting the consultation should be available to discuss the findings and recommendations. When a consultation is requested, the nurse provides a private, comfortable atmosphere where the consultant and the client can meet. A common mistake is to turn the whole problem over to the consultant. The consultant is not there to take over the problem, but to assist the nurse in resolving it. The nurse requesting assistance should plan the consultation for a day when both are scheduled to work and a time when both distractions are minimal. Finally, the nurse incorporates the consultant's recommendations into the plan of care. The success of the advice depends on implementing the problem-solving techniques suggested. Consultants are valuable adjuncts to nursing care. In clinical practice, competent and experienced nurses often encounter problems beyond their knowledge or experience. Professional and competent nurses